relationship of abuse and will go on. So basically, it becomes really challenging. So
from a point of view of drug rehabilitation programs, people who are, falling through the cracks and continuing the usage of, drugs in many ways and forms, whether they're prescriptive or, bought off the street. When somebody goes to a drug rehab program and they are on a chemical, and how does the rehab program works? And if you are replacing a form of chemical compound to another chemical compound, which is of a lower intensity, but similar family of chemical compounds. So how is that the right model of drug rehab, or is there other models tested in the world?
There are various models tested in the world. So there would be a model where it's the methadone program. So people who are addicts then go on a methadone program, and then they are tapered off the drug. See, addiction, especially drug addiction, is really, really difficult. We know that even with alcohol. We've seen alcoholics, it's very difficult for them to give up. Then there's another model, like centers like Palmerston, where a person goes for 6 to 9 months. And actually, he's rehabilitated. They have therapy within that group therapy. They have mentors. People who are overcoming addiction need extreme support for a long period of time. So they'll need a mentor. They'll need family to support them. But they have burned their bridges with their families. Families are too scared. The families feel that they might steal. Families feel that this relationship of abuse and will go on. So basically, it becomes really challenging. So that's another model where they actually have. When a person decides that I need to do this for myself, so I can be back with my family, I can look after my children are now in care, I can look after, then that is the time when they will seek care. They will seek, but they will need that support. It's not impossible, but it's really hard. And I think our system is not doing it very well at the moment.
On a conclusion question, in terms of healthcare equities between men and women in Australia, what do you see broader trends coming out and in your research?
So one of the research that I'm doing now is the Shakti Project. So the Shakti Project is looking at family and domestic violence within culturally and linguistically diverse communities, especially refugee and migrant communities. And we were looking at post-COVID, what happened. So I've interviewed a cross-section of women impacted by domestic violence, and I've interviewed service providers. So we know that family and domestic violence impacts both men and women, but a larger proportion of women are impacted. And it is an area that is actually not considered or funded appropriately at all levels. There's psychological impacts, there's legal impacts, there's financial impacts, there's child support impacts. So all of these impacts are not understood, and it can be long drawn. So that's an area that it's inequitable, and it impacts the women substantially from the research that I've done. It impacts a small amount of men, but both. How do you work with perpetrators? How do you work with men? How do you educate them so that they can share why is it that this happened, this violence happened? So that's one area. The other area is also the area of care burden. Care burden.